Health Education Series, Module 2, Dental Caries, Part 2. Dr. Brecky here. So let's review what we learned in our last lecture, Dental Caries, Part 1. Dental caries is both a chronic and infectious disease. Remember, the proper substrate, bacteria, and environment are all necessary and sufficient to fuel the dental caries process. Caries is a leading childhood problem, and in infants it can be known as baby bottle tooth decay. Remember, never put a baby to bed with a bottle containing anything other than water, because it may very well stimulate the caries process. Lastly, brushing and flossing often, using fluoride, choosing healthful foods, reducing your sugar intake, and visiting your dentist or dental provider regularly are all ways to help prevent dental caries. So, why does this matter to you? Well, what does caries look like? What does caries feel like? What treatments out there exist? And how do we prevent caries? But most importantly, how can we help? Well, how do I know if I have a cavity or dental caries? This may manifest as just sensitivity to sweets, some sensitivity to hot and cold. As it progresses, it may result in loss of tooth structure, visible pits or holes, even a discoloration of teeth from a chalky white to a dark brown or orange. It can also result in pain or swelling and systemic infection. But just remember, early cavities, those which do still require treatment, may have zero symptoms. They may not cause pain. However, they are seen on dental x-rays, so it is very important to go in and visit your dentist regularly. How is caries diagnosed? Well, it's not usually visible in the mouth until it is moderate or severe. Just remember, like I said, x-rays or radiographs are essential for diagnosis of most cavities. Visit your dental provider. It is the best way to see if you have a cavity. When does caries become a concern? Well, when caries is limited to the enamel or outer layer of the tooth, it is called incipient, and this process is reversible. How is it reversible? Well, like we've been telling you, daily fluoride application will actually work to remineralize or reharden that enamel and reverse the caries in those structures. So when does this become an actual concern? Well, when caries has extended into the dentin or the pulp of the tooth towards the inner surfaces of the tooth, the process is then irreversible, unfortunately. In this case, intervention and treatment is required, and it could become severe if left untreated. So just remember, it may not be symptomatic until it is moderate to severe. And at that point, much harder to treat. So where does decay typically form on teeth? After the commercialization of fluoride, caries has shifted from predominantly occurring within the pits and fissures of teeth, which are those deep grooves that you can see, especially back in those molar teeth in the back, to the smooth surfaces of teeth, which means in between and on the sides of teeth. Children are very prone to developing decay on the pits and fissures of teeth. Remember, that's why fluoride and something called sealants are essential for children. For adults, we're prone to developing decay on the smooth surfaces, which can mean in between teeth on the smoother sides or next to the gums. It's typically where we need to floss more. Or it's where something called recession exposes the softer root surfaces and causes something called root caries. That's why adults are more prone to developing caries on smoother surfaces. So what does this look like? Well, these pictures might be a little gross for you, but down on the left here, you can see the pits and fissures, this staining. Now, darkness can just mean staining, but this severe staining has led to a cavity, okay? Gunk has gotten into those grooves and pits and has turned into a sticky, soft cavity. Here on the right side, you can see a cavity on a smooth surface, and that's this, if you were to touch this, it would actually be very soft structure, which has occurred right down at the level of the gums on this tooth. So, kind of icky, but that's what it looks like. And if you don't want to look at it, just visit your dentist. What does severe decay look like? Oof, I hope y'all had your breakfast. First, on the left, there's a young child, and on the right, there's an adult. Gross. We know, but what is much worse? Leaving this untreated could pose severe threats to one's overall health. If you see severe caries, please help that individual to seek treatment. So what's ECC, or early childhood caries? Well, this is extensive dental caries which affects children 0 to 71 months or under 6 years old, with any evidence of a decayed, missing due to caries, or filled surface on their teeth. These are very young children to have caries. In some cases, it can be known as baby bottle tooth decay. What are the challenges of early childhood caries? Young children are just not equipped to have their own oral hygiene habits and behaviors. Pretty much anything a child that age is doing is from the caregiver. So, it's very important that caregivers are hypervigilant about taking care of their child's teeth. Young children also do not control their nutrient intake, which can play a huge role. Parents may lack knowledge about the importance of dental care, and they may lack the finances to seek it. They also may not have access to a dental office, depending on where they live, or transportation, or other means. Treatment of young children can also be much more challenging, even if we do know that they have caries. Sometimes x-rays or radiographs are really tough to achieve, and sometimes treatment can require even putting a child to sleep, which comes with even more risks. So, untreated decay as a young child may lead to pain, infection, disruption of development of permanent teeth, problems with spacing and occlusion, and the bite of the teeth, which can lead to needing braces, among other things. For more information, visit cdhp.org. But, long story short, please take care of those teeth because prevention is key in avoiding a lot of problems for young children who really can't help it themselves. So what are some of the signs and symptoms of caries? Well, mild caries includes really no pain, maybe some sensitivity to sweets, but no really color change in the tooth or anything like that. Moderate caries include sensitivity to sweets, sensitivity to hot and cold, some visible color change, or maybe some loss of tooth structure. This is when you really want to seek urgent dental care. Severe caries includes spontaneous pain, severe pain to hot and cold, some swelling, or even an active fistula or some pus. This requires you to seek urgent medical or dental care. It's very important. If symptoms become severe and include fever or swelling or any kind of signs of infection, do not delay medical care. This could be the sign of a life-threatening emergency in some cases. So what would the treatment of caries be in these cases? Well, mild caries may just include a composite or amalgam filling or something called silver diamine fluoride, which we'll get into later. Moderate caries, which is penetrating well into the dentin of a tooth towards the pulp, may include a large filling, a crown, or even something called the specialized liner, glass ionomer, at the depth of the filling. Now, severe caries may include a root canal, a crown, or an extraction of a tooth. And that's what gets quite expensive. So as you can see below, these two lower images show you before treatment of caries on some front teeth there and then afterwards. And it looks quite beautiful, but The true importance here is eliminating the disease process that could result in infection for that person. So what are some treatment costs of caries? Well, when caries are diagnosed as mild, it may just include a filling or silver diamine fluoride, like we discussed. It's a little bit less expensive. As you can see by this chart, as you move on over to more severe caries, the treatment for saving a tooth with severe caries becomes very, very expensive. It may include a root canal and a crown, which can be almost $3,000 or more for that tooth. But just remember, costs of analgesics range from $50 about for nitrous oxide to even over $2,000 for general anesthetic if a patient is able to need that. Now, just know these pricing estimations do vary, but what we're showing you is that smaller cavities, much, much easier and much less costly to treat than large ones. Now, this is my favorite. What are the costs of prevention? Well, at home, toothpaste, it can be very expensive for people. Toothbrushes and toothpaste, that's just not something everyone can afford. However, it is much, much, much less expensive than treatment in a dental office. Routine visits to an office include exams, x-rays, cleanings, and fluoride varnish, which is a professional application of fluoride. And even that ranges from, $50 to $150 to $250. Whereas also in-office fluoride applications and sealants are also relatively inexpensive compared to treatment of caries. Overall, it certainly pays to take care of your teeth. So why care about dental caries? It is the most common disease worldwide. It is the #1 cause of tooth loss, and it is the cause for much pain, suffering, and costly dental treatments. Importantly, it is 100% preventable. How can we reverse this epidemic? You can. Education. Help patients, especially young children, establish healthy oral hygiene behaviors from a young age that they can continue for the rest of their lives. This is how we can reverse the trend. It's you. So what is the best way to prevent caries? Well, home behaviors are over 90% of the battle. Brushing teeth twice daily with fluoride toothpaste and flossing too. Modeling those good behaviors for young children and practicing those home behaviors as an adult are both key. So, overall, there are multiple facets for possible intervention and prevention of dental caries. What are some tips for parents? Well, use fluoride toothpaste 2 times per day. Limit fruit juice to 1 cup per day. Put your child to bed with water only. And visit the dentist by age 1 and every 6 months for the rest of your life. Limit your snacking frequency and reduce added sugars in your diet. Pursue dental sealants when they're indicated and model good behavior. That's #1. So some public health initiatives in place to prevent or treat caries include community water fluoridation, which we'll get into later, educational campaigns, school-based sealant programs, and school-based dental health centers, fluoride varnish provided in medical offices. Don't be surprised if your nurse or doctor for your primary care checkup asks you if you would like some fluoride varnish for your child. For treatment, there are school-based dental clinics, there are free dental care clinics, and even free dental care events, such as something called Missions of Mercy. And for both prevention and treatment, some initiatives in place are Medicaid coverage and expansion nationwide and in particular states to provide increased access to dental care for those who need it most. Also, expanding the dental team and workforce, creating dental therapists. This is something else we'll get into detail in later lectures. And a guide for resources. Don't hesitate to seek advice from dental professionals. Review your diet with your primary care provider, a dietitian, or even a nutritionist, or your dentist, and explore the literature. It can be fun. And lastly, embrace technology. Yep, there's an app for that. Focus on prevention instead of treatment. You don't have to brush all of your teeth, just the ones you'd like to keep. A smile is the prettiest thing you'll ever wear. Remember, 2 minutes, twice per day. An ounce of prevention is worth a pound of cure. Benjamin Franklin. Thank you to our sponsors. With questions regarding this module, please contact BreckyHuddleston@gmail.com. Otherwise, we will see you next time.